So, Jyoti, a question for you is, when we're dealing with myeloproliferative neoplasms, how do you decide on your approach to treatment for these diseases?
That's a good question, thank you. There are several aspects to treatment. The first is really preventing that risk of thrombosis or hemorrhage bleeding that may occur when blood counts are very high, either high platelets or too many red cells. We have guidelines that allow us to estimate an individual person's risk, and that may be based on what diagnosis they have, be it polycythemia vera or essential thrombocythemia, how high their blood counts are. For example, is their hematocrit raised above a standard cutoff, or is their platelet count raised? What is the age of the individual? And what are their risk factors for thrombosis? So, for example, have they had a previous clot, or do they have other diseases that may increase their risk, such as diabetes or a history of heart disease? And we take all of this into account and we determine whether people are at high risk of a blood clot or lower risk of a blood clot, and that then drives how aggressive we are with our treatment. So, individuals who are at a lower risk, we may just choose to monitor or give an aspirin, provided their blood counts are within the ranges that we've all agreed are safe. And otherwise, we actively give medication to reduce blood counts. And those medications can be tablet forms or they can be injection forms of treatment that people generally take long term to keep their risk of thrombosis low. As people advance to more advanced disease, there are newer agents such as JAK inhibitors that can reduce the activity of the condition and help with patients' symptoms and things like where the spleen becomes very large and uncomfortable, it can help with that. So there are additional treatments that can help with very specific aspects of the spectrum of disease. Ultimately, the Holy Grail is to also have treatments that prevent progression, and that is an active area of research. And some of the treatments that we use, there is emerging data that they may also help with slowing down the pace of progression of disease, is ultimately where we would want to get to as a community.
Wonderful, thank you.